client care and the body systems. Body system 1. Cardiovascular. What it does: move blood in order to deliver oxygen and remove carbon dioxide from the different parts of the body. Parts of the system: heart, blood vessels, arteries, veins, and capillaries. Blood. Normal changes of aging. Blood vessels love flexibility. Heart does not pump as effectively. Disorders: hypertension, hypotension, congestive heart failure, CHF, heart attack, stroke or CVA, heart arrhythmia. Body system 2. Respiratory. What it does: manage the transfers of oxygen from the air to the blood, and remove carbon dioxide from the blood for transfer to the air. Parts of the system: nose, throat, pharynx, voice box, larynx, windpipe, trachea, bronchi, lungs. Normal changes of aging: less breathing capacity. Lungs are less elastic. The transfer of oxygen and carbon dioxide in the lung is less efficient. Disorders: upper respiratory infections, URI, pneumonia, chronic obstructive pulmonary disease, COPD, asthma. Body system 3. Integumentary, skin. What it does: epidermis, barrier against bacteria and moisture, holds in moisture to keep body tissues from drying out. Dermis, contains hair follicles, oil glands, sweat glands that regulate body temperature, and sense receptors that identify pain, pressure, heat, cold, etc. Subcutaneous tissue, fibrous tissue connects the upper skin layers to the skeletal muscles. Fatty tissue holds in body heat, provides insulation, and provides an energy source. Parts of the system: 3 layers of skin. Epidermis, dermis, hair follicles, oil glands, sweat glands, sense receptors. Subcutaneous tissue, fibrous tissue, fatty tissue. Normal changes of aging: epidermis becomes thinner and paler. Dermis and subcutaneous tissue have less blood supply. Subcutaneous fat decreases, especially in arms and legs. Skin becomes folded, lined and wrinkled, and is less able to regulate body temperature. Nails become dull, brittle, hard and thick. Disorders: pressure ulcers, bed sores, stasis, venous ulcers, arterial ulcers, diabetic, rashes and infections, burns, skin cancer, lesions, dehisced wounds, fistulas. Body system 4. Genitourinary. What it does: get rid of waste products through urine. Regulate the amount of water in the body. Regulate the chemical balance in the blood. Reproduction. Parts of the system: 2 kidneys, 2 ulcers, urinary bladder, urethra. Male and female reproductive organs. Normal changes of aging: blood flow to kidney is less. Less muscle tone in bladder. Bladder can hold less urine. Some find it difficult to completely empty the bladder. Disorders: urinary tract infection, UTI, incontinence, urge, stress, and overflow. Enlarged prostate. Body system 5. Gastrointestinal. What it does: changes food into substances that can be used by all the cells in the body. Gets rid of waste products through feces. Major parts of the system: mouth, esophagus, stomach, small intestine, large intestine, colon, liver, gallbladder, pancreas. Normal changes of aging: decrease number of taste buds, decreased chewing capacity, due to tooth decay or tooth loss, decrease in amount of digestive enzymes, decrease in bowel muscle tone, decreased mobility in the intestines, decreased nutrient absorption, disorders, constipation, fecal impaction, hemorrhoids, gastrointestinal ulcer, colitis, irritable bowel, dehydration, GERD. Body system. 6. Endocrine. What it does. Produces chemicals called hormones which regulate and control body activities and growth. Major parts of the system. Glands that produce hormones into the bloodstream. Glands include pituitary, thyroid, parathyroid, adrenals, pancreas, ovaries, testes. Normal changes of aging. Decrease in amount of hormone produced. Diabetes mellitus, type 1 and 2. Hypothyroidism. Body system. 7. Nervous. What it does. Coordinates body functions and monitors changes in the body and the environment. Major parts of the system. Brain. Spinal cord. Nerves. Normal changing of aging. Decreased number of nerve cells. Transmissions at the nerve endings slow down throughout the body. Disorders. Seizures and epilepsy. Parkinson's disease and other tremors. Alzheimer's and other dementias. Traumatic brain injury, TBI. Body system. 8. Musculoskeletal. What it does. Protects the internal body organs, provides a framework for the body, maintains posture, and makes body movement possible. Major parts of the system. Bones. Muscles. Ligaments. Tendons. Cartilage. Normal changes of aging. Joints stiffen. Muscles may become weaker. Bones lose calcium and become more prone to breaking. Spinal column shortens. Disorders. Osteoporosis. Arthritis. Fractures. Body system. 9. Sensory. What it does. Gives the body information about the world around it through sight, smell, hearing, touch, and taste. Major parts of the system. Eyes. Ears. Nose. Skin. Tongue. Normal changes of aging. Eyes. Pupils in the eyes react more slowly to changes in light. Eyelids may get droopy and not close as tightly. Amount of tears is less. Ears. Change in the ability to conduct sound. Change in the functioning of the little hair cells in the ear canal. Disorders. Eyes. Cataracts. Glaucoma. Macular degeneration. Diabetic retinopathy. Dry eyes. Ears. Hearing loss. Tinnitus. Vertigo of dizziness.